Yeah, I don't think the use of PrEP is going to change that, because PrEP has no impact on.
Well, I think what you're getting at is whether there's a
Sexual
changing in behaviors when more unprotected
Yeah, no,
sex.
but-
Right. So, I mean, I think it's debatable. The studies have suggested that does not occur, that there's not.
But I think the
but-
point is that in the studies, the amount of sexual transmitted diseases other than HIV, which people have, is so high.
Yeah.
I mean, you can't have more than, in that short period in the IPRG, they have a mean of 3 STDs. So it's not that risk behavior already exists with or without
Well,
PrEP.
that's the point.
And so PrEP is just helping at least to prevent the HIV part. It's not going to change the other part, but that part per se is at such a high rate, it's impossible that will go up further. And there were some hepatitis C infections in that study as well. So I think.
I think the issue is if it's expanded more broadly, and people who formerly would have used condoms a lot start not using condoms.
Our sort of hypothesis at the moment is that this is a condom gap that PrEP is filling. That gap already existed, hence the very high incidence rates we are seeing pre-PrEP. So the individuals who are stepping forward for PrEP are the kinds of people who would have stepped forward for PEP, except people can't get themselves organized to get PEP. And so what we are now very much promoting, because we've seen fantastic evidence of reduction of incidence of HIV, is that people come to PrEP so that they are protected prior to their sexual encounters. Time may tell that actually we begin to see some of this other, happening. Obviously, if indeed, as has already been suggested, these are individuals who would not have used condoms anyway, then all we're doing is making sure they're not going to be getting HIV. That does not address, therefore, the Hep C side of things. And that raises this question of, will test and treat in the Hep C environment also have an impact in terms of bringing down rates, reducing the numbers of fish in the pool, etc. And so, I think this, hence, and to reiterate again, the International AIDS Society has taken this on because it's clear these two are very closely related. And our responses are very closely related in terms of the interactions that may happen. And I think we're going to have to keep an eye on it and see where we go.
I don't think that the incidence of acute hepatitis C is going to change. I think the bigger question for us from a treating side is, if we would have quick treatment available, which would be without side effects, could we then sort of, have a real change in the size of those who are infected and have less transmission? And the problem is that currently for treatment of acute hepatitis C, which is the first 6 months, where you sort of have to wait till someone does spontaneously cure, yes or no, then you have a lot of time to infect people, and you're very highly viremic during these initial phase. Everything is like HIV, really, and so that the biggest risk of transmission is probably during that very acute phase of infection. And the question is, because people see their HIV doctor regularly, get tested, we really pick up these acute hepatitis. I don't think we miss a lot, at least not in the HIV positive ones. And the question is, we would have a better intervention at that time. The problem is that only pegylated interferon ribavirin is currently available. Now, obviously, no one wants that pegylated interferon anymore. Plus, if you don't respond very well and you're not negative at week 4, you have to treat for 1 year. So it's even easier to start treating with oral DAs once you're chronic and you're still earlier finished than if you treat with interferon due to the acute phase. So that has really brought down the number of people who are treated during acute hepatitis C. So if we see more infections now, I think that will just reflect that less people are really undergoing treatment at this point.
Yeah, this is really important. I mean, one thing about the scenario you described, that's a bit of a wild card. The person who said he was HIV positive could have been on suppressive therapy and then would be much, much less likely to transmit. So I wonder if we are able to really provide treatment to people with acute hepatitis C. These drugs just drop the viral load so dramatically and so quickly, it's possible that even while someone's on treatment, before they finish it, that they'd be much, much less likely to transmit hepatitis C during the acute phase as well. And the other thing is, some of this is what I think of as a microculture. Like, not every HIV positive man who has sex with other men is sort of involved with this cluster of risk behaviors. There's biologicals, culture. It's an interaction of many, many things. So I think if you consider that, it'll be very interesting to follow the epidemiology in the next couple of years and see how things move.